Now joining us in the studio for more on the subject is Randy Capps, Director of Research, U.S. Programs with the Migration Policy Institute. Mr. Capps, welcome to Africa 54.
Hi, thanks for having me on the program today.
Incredible findings, actually, when I was going through the report. Wasting more prevalent among young Somalis, for example, by 23%, and stunting more prevalent among young Somalis by 26%. Of course, the research was conducted among other children, Iraqi and Burmese. Tell us about these findings. What did you find really surprising there?
Well, sure, and first I have to credit the report's authors led by Beth Dawson-Hahn at University of Washington, so they really put this together. I mean, this is the first sophisticated sampling that's been done of nutritional status among refugee children coming to the United States, and I do think that the findings for the Somali children stand out. They are the most likely to be severely undernourished, to have severe underweight, which is referred to as wasting. Among the groups included in the study, a much higher rate than we see in the general U.S. population.
And a lot of studies that we've seen of refugees are focused very often on young children from birth to age 5, and the data actually that I mentioned earlier were for that age range. The study also looked at children age 5 to 10, and for example, 24% of Somali children are confronted with waste. I mean, they are experiencing wasted as well. So why was it important to shed a light on that age range? Well,
you have children of all ages that are resettled to the United States. And in fact, we think among the Somali refugees coming to the United States, more than half of them are children. And what this report shows is, wasting it's most severe for the youngest kids, right? It's an issue with infant mortality among very young children. But what this report shows is also an ongoing issue for children when they get older. And there are a lot of children living in the refugee camps and elsewhere in Africa that have the severe malnutrition that are going to be coming to the United States at some point.
So to what extent does this issue call for concern?
Well, it is a big concern. I know in the refugee resettlement world, it's a very big concern. The United Nations is concerned about it. They've developed special packets for food just to treat it that they give children in refugee settings. It's a longer-term concern, of course, for children's health and well-being and development. If they stay there in their refugee setting or even after they arrive in the United States.
So when you think about it, though, some may say that people that are refugees here, children in particular, as we're talking about them, maybe have a better chance of addressing these issues as opposed to resettling in other places. When we look at Kenya, that is hosting so many refugees, what do you think in terms of the refugees that are here that really they have in terms of some of the benefits that other refugees may not have?
We resettle in the United States about 70,000 now. It's up to 85,000, and it's supposed to go up to 100,000 refugees per year, but there's hundreds of thousands in some refugee camps in Kenya alone. So we resettle a small percentage of the total to start with. But we have a commitment, and we have a very strong U.S. government program combined with the private sector that provides basic health services, health screening, training for the parents, all the things that people need to settle in their lives here. Okay. So once they get to the United States, they'll have a whole range of services, but those people providing the services, they need good information. They need to know about the health of these children when they arrive.
And one of the recommendations, quickly, because we're out of time, talks about addressing the entire spectrum of malnutrition.
Yes, that's correct. And the other issue, as you mentioned, is stunting, which is being too short for age. That has long-term health consequences. Children need a much better balanced diet, which is a little more difficult to address in the long run.
Okay, Mr. Capps, thank you so much for joining us.
Thanks for having me on.